We know that some of the core symptoms of ADHD can also be seen in other types of common childhood problems like anxiety or depression. For example, a kid that's anxious might appear overactive, or a kid that's depressed might appear distracted or, kind of lost in their thoughts. How do you tell what's ADHD?
I think it's a really important question and kind of, essential to the issue of ADHD, which is often overdiagnosed. So it's a hard thing to determine, sometimes. You always want to ask about those other symptoms, and there's the anxiety symptoms, whether somebody has other elements of anxiety or other elements of depression, like mood symptoms, like nervousness or panic kind of things related to anxiety. So you want to see if those other disorders or those other diagnoses, if there are aspects of them that are present. Because we don't really have a definitive test for these things. While we have an understanding about ADHD, that where in the brain it's located or the difficulties are located, we don't really have a blood test or a scan test to determine. So take a good history, that's very important. Understanding what the child's development was like from early on, because you usually will see elements of hyperactivity, impulsivity from early childhood, from toddlerhood. All young children, toddlers, can be somewhat impulsive and hyperactive. It's still they're still developing those regulatory mechanisms, but the ones who have ADHD will often stand out. So a good history is very important in learning about whether that was present early on. And also getting data, good data from teachers and parents about the level of distractibility and the impulsivity, memory, organization, seeing if there's a whole kind of composite, a whole picture that you can put together that would fit with what we understand to be part of the diagnosis of ADHD.
How do you know that you've made the right diagnosis?
I think it's a really good thing to think about. It's something one should always be thinking about, because it isn't a definitive diagnosis. In other words, it's not a blood test that it's there or it's not there. You can be convinced of it, but then there might be other things that come into the picture that you learn about, whether it's the history or whether it's other symptoms that you hadn't heard about that make you question what the diagnosis is. So I think it's something that should always be in one's mind when making any kind of diagnosis, but ADHD, because it is so much overlap with other diagnoses, to think about, is this still the right diagnosis? And if that's a diagnosis that you make initially, you continue with that diagnosis until something happens or you learn something that would change your mind.